Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 115. The advantages and disadvantages of electronic health records. The U.S. has been experimenting with electronic health records, or EHRs, for more than 15 years. One goal of EHRs is to allow the electronic interchange of health data. Yet even today, if you need to transfer your records from one doctor to another in different companies, it will likely be done by faxing. I will discuss the reason for this later in this podcast, but for now, I want to go over some of the advantages and disadvantages of EHRs. I have talked to several doctors who have several issues with EHRs. Some of the complaints against EHRs include they require too much unnecessary information. One physician I interviewed said that doctors spend 2 hours on the computer for every hour of FaceTime with the patient. The paragraph or two of necessary information can be buried in 4 or 5 pages of extraneous information. Instead of focusing on patient care, the EHRs are focused on billing. And, as mentioned previously, medical records cannot be exchanged electronically. They still need to be faxed and then entered manually. A physician I follow on social media argues that doctors should go back to paper records. Because EHRs require so much data, he argues that paper records allow more interaction with the patient. It is easier to find the necessary data on paper records since there is very little unnecessary data. Both of the previous claims have validity. The last claim of the physician that I will be discussing is that paper records are more secure because it's harder to copy and steal paper records. This claim is a bit more problematic and provides a segue into some of the advantages of EHRs. So, are paper records more secure? It depends. If somebody breaks into the office, the paper records can be stolen. However, it would be hard to steal all the records because of the size and weight of all the files. And you would have to search through the records manually to find the data you want. If the computer system can be hacked, it would be possible to fairly quickly download all the records and then search through them to find the records you want. Most EHRs probably encrypt their data, making access harder even if they are hacked. Most paper records have no backups. So if there is a disaster, such as a fire or flood, all records could be lost. Most important computer data is backed up, or it should be, so it can be recovered in case of fire or flood. Whether paper records or EHRs are more secure will depend on what risk you are most concerned with. EHRs have advantages over paper records. They provide the output in a standard format, and you don't have to decipher handwriting. The software can automatically be set to notify doctors and patients about scheduling procedures or needing to refill prescriptions. EHRs can quickly present and summarize historical data to spot trends. For example, if someone has high blood pressure, the software could create a graph that shows if the medication is working or not. One big advantage of EHRs is that they can collate large amounts of data to spot trends. During the COVID pandemic, England and Israel were able to use their data from their national healthcare systems to check the side effects of the COVID vaccines. So why can't EHRs in the US share data? One reason is that EHR companies want to protect their profits, so they make it hard to share data. This is at least partially caused by the fact that healthcare in the US is for profit, and these companies are focused on profit above all else. Until that changes, getting EHR companies to share data is going to be a tough sell. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.